There we go. Now you're good.
Okay, good morning, everybody. Dan Bates, President CEO, Greater Hamilton Chamber of Commerce. We are thrilled for all of you who are joining us today. We have two audiences. We have one on Zoom, and they can ask questions directly of the presenter. And those on Facebook Live, if you type in your question, Tiffany then will repeat it to the speaker, and she can answer that question. So today we have Barbara Rose, and she's going to be talking to us about hospice care. So we will get back to that in just a moment, and Barbara can introduce herself and get started once we do self-introductions. So you all know who I am, so now let's find out who some of you are. Laura.
All right, I will kick it off. I'm Laura Merrill with the Greater Hamilton Chamber. We'll just go around the screen and tell us your name and what company you're with. So Terry, we will start off with you.
Thank you, Laura. Good morning, everyone. I'm Terry Ellsworth, Senior Account Executive with Hospice of Cincinnati.
Nancy, you're next.
I'm Nancy O'Neill with the Greater Hamilton Chamber.
Barb, we'll let you give a short introduction.
Good morning. I'm Barbara Rose. I'm the Senior Project Administrator for all of the advanced illness programs at Hospice of Cincinnati. Really appreciate the opportunity to speak with you. I've been with Hospice of Cincinnati for 8 years, designing and implementing new advanced illness programs. I've been in healthcare for a very long time, generally doing community improvement and impact work, the last 8 years being in better end of life care. Thanks.
All right, awesome. We'll get to hear a lot more from you in a minute. And then is it Greg?
Yes, it is.
Okay, Greg.
My name is Greg Piron with Professional Case Management. I'm the Regional Outreach Specialist for basically Ohio. We're a home health care agency that specializes in the men and women that have worked in the nuclear weaponry complex, like Fernald and Mound, who have been exposed to radiological and toxic substances, and we take care of them at home.
Great, thank you. Welcome. We're glad to have you here today. Jill?
Hi, I'm Jill Cates. I'm with Easter Seals Career Connection. This is a program that helps develop young adults between the ages of 16 and 24 advance in their career path and employment due to some barriers or challenges they may incur.
And Roma, you're next.
Hey everyone, this is Roma Patel from Team Logic IT, and we provide outsource IT for smaller companies.
Awesome, thank you. Glad you're here today too. Tiffany?
Hi, I'm Tiffany Grubb with the Greater Hamilton Chamber.
All right, so are you to Facebook yet? No, all right. Well, taking a second to get on Facebook. But that's all right. So Barb, as we go along, if Tiffany has a question on Facebook, she'll just raise her hand and let you know what the question is. Anytime during the discussion today, if anybody has questions, feel free to ask Barb and or type them in the chat and we can get them to her too. So, all right, Barb, it's all up to you then.
Great, thanks. Terry's going to help me navigate my slides. Again, I appreciate the opportunity to really talk about a whole spectrum of services. I will touch on what hospice care includes and is about, but I think that it really helps lots of different audiences to have a context of all kinds of advanced illness programs. So up on the screen, you'll see some names of programs that fall under the umbrella of Hospice of Cincinnati. Conversations of a Lifetime is our advanced care planning program. Palliative care is near and dear to my heart. It's a home-based palliative care service. I'll talk a little bit about that. Our Social Connections program, which is non-medical phone and volunteer support when we're not in the middle of a pandemic, and then a little bit about hospice care. Next slide, Terry. So whenever we talk about advanced care planning and who would speak for you if you couldn't speak for yourself, that's really the cornerstone of what we call advanced care planning. A lot of times folks with serious illness find themselves bouncing back and forth into the hospital, sometimes a skilled nursing facility, sometimes at home. And we, at any level of advanced illness care, we start with who would speak for you if you couldn't speak for yourself? And the sort of official name or formal name of that is a healthcare proxy or a healthcare decision maker, healthcare power of attorney, depending on the state, but in Ohio we call it healthcare power of attorney. And this is kind of the founding question. Next slide, Terry. So we have a website, Hospice of Cincinnati, Hospice of Hamilton has a website. And Conversations of a Lifetime we have a separate website, and there's a lot of these materials that you can find on our website, conversationsofalifetime.org. And if you don't look at anything else or you don't listen to anything else, sometimes we find that advanced illness and hospice care can be sort of scary, and there's a lot of misconceptions about the care that we provide. But I really recommend this particular sheet that we've developed. It's an educational sheet. We talk to all kinds of audiences, professional audiences, healthcare audiences, lay audiences, about what is advanced care planning, what are the directives, and why do we need to have that into place. So really anyone over 18 should really think about who would their decision maker be, who would be their healthcare power of attorney, and why you would want to designate that now. And a lot of times we think that it's not really necessary unless we have a serious illness, we're in decline, we might be close to death, but really it's a good idea for any adult to know who would make those decisions for them. And it really ends up being a bit of a roadmap for your family, your loved ones, as well as your healthcare providers. So we're, many of us don't think about this situation, but you never know when something can happen and you can be in a healthcare environment and not be able to speak for yourself. So advanced directives then are the forms, the legal forms, which vary a little bit state to state, and Ohio's are fairly long. They all kind of communicate the general idea of healthcare power of attorney and living will, what your wishes are. For example, since we're in Southwest Ohio, we also we do a fair amount of education and work in Northern Kentucky, and I can tell you that the Kentucky forms are much easier and much more straightforward. And the great thing about advanced directives is that you don't have to have a lawyer to actually complete them. It helps to have a guide to kind of go through and make sure you understand the language. We do that at Conversations of a Lifetime in Hospice of Cincinnati, and certainly a lawyer can do these forms as well, but essentially you read through them, you make your decisions, and you can have your signature notarized, and then it's a valid form. So if you haven't done a healthcare power of attorney or a living will, particularly the healthcare power of attorney, I encourage you to download the form. Again, you can get it on conversationsofalifetime.org, and you can get it on other sites as well from Ohio. And just talk to those in your circle, your loved ones, your best friend, whoever might be in a situation to say, well, I remember talking to Barb when we were having a glass of wine, and she very specifically said that she would not be interested in this type of care or that type of care, and then document it on these advanced directives. Terry, go ahead and go to the next slide. So this is a piece of the advanced care planning. This quiz, it's a very simple, I think it's maybe 10 or 12 questions. This is a quiz, and medical proxy is the same language. So healthcare decision maker, healthcare power of attorney, medical proxy, those are all different names for the same thing, the decision maker. And this quiz is really helpful to align your wishes. And again, this is all about individual decision making and individual wishes. Advanced illness and hospice care, again, gets a bit of a bad rap, a lot of misconceptions and misunderstandings. This is all about thinking ahead of time before there's a medical crisis about what's important to you and what you want. This is not about withholding care. This is not about someone else making decisions about what level of care you get. This is a guidepost for for all of us in the event that we couldn't speak for ourselves. But the reason I really like this particular tool, again, it's very easy to access, is that it has a number of questions, just multiple choice questions about scenarios. If you were in an accident and unconscious and had a breathing tube, and there were some choices that need to be made, which one of these choices fits best with your particular values and goals? And then you answer these questions, and then you have your proxy, the person that would speak for you. So it could be your wife, it could be your sister, it could be your best friend. You want to choose someone who could speak for you, who's aligned with what your goals are. So for example, if you say, absolutely, I don't want a breathing tube, I don't want CPR, I don't want to go to a long-term care facility, you want to choose a healthcare proxy that's going to be able to support what your goals are. But this quiz is pretty easy to do, and you answer the questions, you have your proxy answer the questions, and then you compare answers. And it gives a couple of good discussion points, because what we know, what the evidence tells us, is that people who have been chosen as a healthcare proxy, there's actually a fair amount of, what do I want to say, variation. Oh, I'm pretty sure I know what Barb wants. And then you do this quiz, and I choose a certain set of answers that fit my goals, and my proxy is like, oh my gosh, I had no idea you didn't want this done or that done. So it's a very simple way to align the conversation as you're working toward having a healthcare power of attorney signed. So again, it's just another tool. And that's one of the things I think we've done really well in Conversations of a Lifetime, is we present a lot of information that is out there, known to be evidence-based, used across the country. And some of these tools will resonate more with folks than others, but it's just really a variety of tools for information and to start those conversations with your loved one, right? The time to have these conversations is not when your loved one is in ICU, can't speak for themselves, and there's lots of decisions to be made. Any questions about the being a good proxy, a good healthcare decision maker? This is a great tool. We really like this. Okay, Terry, next slide. This has actually been around for about 8 years. Put out the Conversation Project, which sounds a lot like Conversations of a Lifetime, but different. It was actually started right about the same time we were getting started at Hospice of Cincinnati and doing advanced care planning. This is from the Institute for Healthcare Improvement, the IHI in Boston. And there's just been a kind of a groundswell of interest and information in helping healthcare providers, as well as the community at large, in really thinking about these decisions and goals and wishes way before you ever need to make those decisions. So another tool called the Conversation Starter Kit. It is on our website. And you can also go right to the IHI and download it. It's several pages, it's 10 or 11 pages, intended to start the conversation at a family dinner or some other kind of group activity, and it goes through a number of questions. These questions are pretty general. I think the medical proxy quiz and then this values worksheet I'm going to show you a little bit more specific. And this kit comes in a variety of languages. There's actually one for families who have a family member with a diagnosis of dementia. That's a great example of, actually this one is, the purple one is a Conversation Starter Kit for people with Alzheimer's or other forms of dementia. You want to make sure, if you've got somebody in your family or in your circle with that kind of diagnosis, that you know, you have a good understanding of what they might want, because as their disease progresses and they're not able to make clear, coherent decisions for themselves, this is where you would want the proxy to be pretty clear what Uncle Bob said he wanted before Uncle Bob's dementia diagnosis progresses. So you can get the conversation starter kit in lots of languages. I believe there's one for pediatrics. So if you've got a child with a serious illness, guided questions around conversations in advanced care planning for kids, multiple languages, dementia diagnosis. So again, really recommend this tool. It's much more aimed at a lay audience and not a whole lot of healthcare language in it, which I think can really be easier to adapt to. Okay, next, oh, and this is the last example of one of the tools that we have on our website. This is a values worksheet. Just having everybody, or having you or your proxy, or having you and your spouse or your best friend or your sister, whomever, just give some thought ahead of time in kind of an objective, not emotional time about what kinds of values you bring to your decision making. And when I talk in a little bit about our home palliative care programming, as I'm presenting you these tools and the context, it seems a little bit abstract, like I'm not really sure why I would do this. And I can tell you from firsthand experience managing this home palliative care team of nurse practitioners who go into the home of folks with serious illness and really open up the conversation with what is, as your illness progresses, what's most important to you and how can we help you achieve that. These kinds of questions really help guide that care. There's so many decisions to be made, and if any of you have had an experience with the healthcare system, and pretty much who hasn't, we have access to a lot of really wonderful high-tech care, lots of tests and procedures and medications and all of that, which is terrific. However, for some people at some point, they get to the point where they just say, please, no more of that. I just want to be comfortable. I don't want to go back to the hospital. I don't want that, you know, X, Y, or Z. And that's also a part of advanced care planning, serious illness care, farther down the road if you've got a serious illness. So I'm a big believer in having conversations, not pressuring people, not you know, suggesting, well, I think you should do this, but really thinking about it. And I can tell you in the last 8 years, as I've developed these programs and met with experts and met with families and met with physicians, people know that this is a good thing to do, but there's just a lot of anxiety and emotion around doing this. But I guarantee you, if you have some version of these conversations, choose a proxy that you really trust, who would help decision make for you, that in the event that you need that person in those decisions, you will be really glad that you took the time to do this. And it's a process. We say that this is not a one and done kind of conversation. I have actually one of my very best friends who is a neurological nurse practitioner down in the Atlanta area where we went to nursing school, taking care of really sick patients. And if you're a neuro in the neuro ICU or taking care of really sick patients on the floor who have had a neurological event, many of those patients can't speak for themselves because of whatever happened to them, an injury or a stroke or whatever. And she and I were talking recently about a case, a patient that she was taking care of that's our age, right, in our early 60s, in this huge event and the kinds of things. So the ICU, the hospital in the ICU has saved his life, and now he's got quite a journey ahead of him with lots of interventions and not being able to communicate and people not being able to visit because of COVID. And just she and I were kind of revisiting, and then I was revisiting with my partner, wow, if something this dramatic happened to me, here's what it would be really important to me. And so you can speak for me because I couldn't speak for myself. You can make sure my kids are clear that this is exactly what Barb said she wanted. So you just never know when this kind of situation arises. And that's why I'm a big advocate of having people think about it and talk about it and put it into writing before you need it. So that's that's the overview of advanced care planning, supported by Conversations of a Lifetime. And there's also many other sites and documents out there. Tiffany, are there any questions about that portion of the presentation? Probably the most important one. That's why I usually start with that, because just trying to get people's head wrapped around why it's important to have those conversations in a proxy.
Not on
Okay,
Facebook. It is currently not letting me connect, but we can stop if anybody on the Zoom call has specific questions. Feel free to unmute and ask those.
I have a question, Barbara.
Yeah.
How do you get the process started? I mean, do you just call somebody? Do you download forms from your website? Like, how would you start this process?
Actually, so that's a good question. There's a couple different ways to do it. I would actually invite you to go to our website first, because we have so many, there's video clips. We did a lot of community engagement activities. And then the forms and tools that I showed you are on there, the one-page tip sheet, and then some of these other forms. I think really that's the best way to get started. And then if you have technical questions, you can send us an email or give us a call. But I think people are most comfortable in starting with, I would start with that one page, what is advanced care planning, or the medical proxy quiz. Either one of those would be a really good place to start, and then kind of go from there.
Could you put that website address in the chat?
Sure.
Great.
Sure. So can either Terry or Brittany do that? This is all one word. Conversations, plural, conversationsofalifetime.org.
Thank you.
Yep, and then it will be in the getting started bubble. Okay. Hey Terry, can you go back to social connections? I just want to talk a little bit about that. There we go. Okay, so I'm just going to talk briefly about this program. This is sort of in the whole umbrella of advanced illness. So late last year at Hospice of Cincinnati, as we expanded our home palliative care service, which I'm going to talk about, we had some conversation about those folks with serious illness. When I say serious illness, I'm talking about things like certainly advanced cancer, which we all know is a very serious illness, has lots of treatment options, and then sometimes we get to a point where there's not really a whole lot more we can do treatment-wise. But I'm also talking about congestive heart failure, or CHF, if you're in the medical world, chronic lung disease, COPD, advanced liver or kidney disease, advanced dementia. A lot of times advancing dementia also comes with a lot of behaviors that need to be managed. So all of those serious illnesses, we see folks are in decline. And they're taking medications for their symptoms. Sometimes they're going back and forth to the hospital, but they're not curable. That's what, when I say serious illness in decline, that means that somebody's got a serious illness like congestive heart failure that they're not ever going to recover from, and eventually it's likely that that's what they will die from. However, folks live with serious illness, oftentimes for many years, and they'll sort of be on an even keel, and then they'll have a flare up and maybe go back to the hospital and get weaker and get some care, and then maybe they go to long-term care or rehab for a few weeks and then come home, and then are just sort of on that trajectory of going downhill, not feeling great, but then also can stabilize, right? So they're not really ready for hospice care. They may or may not be ready for palliative care, but it's hard for them to get around. They may be living by themselves. So the social connections is really it's non-medical, it's not a nurse, way of helping folks with serious illness who might be socially isolated stay in touch with somebody. So we have a companion volunteer that'll make phone calls. We have a program coordinator who We'd like to have a nurse evaluate the patient just to make sure, the person, just to make sure there are not other medical needs in place. And then we will reach out to them by phone once a week, once a month. We'll reach out to their caregiver. When we're permitted to send volunteers out into the field, we can have a volunteer come in, again, to address that social isolation part of being seriously ill. So we were just getting this off the ground when the pandemic hit and we all had to stay home and volunteers aren't permitted to go out into the world. So we do phone volunteer connection, and then hopefully eventually as things settle down with the pandemic, we'll be able to send volunteers back out. So it's a specialized program. It goes through our umbrella of Hospice of Cincinnati, Hospice of Hamilton, but it's just one more way that we can serve folks with serious illness and their caregivers. Okay, and this is just kind of an overview of the Social Connections program. So this is our program of little over 3 years. Palliative Cincinnati, or you could say Hamilton. We do have a nurse practitioner sort of up in that area as well. And I have the definition of what palliative is right here on this very first slide. As we talk again, I enjoy the opportunity of talking to all different kinds of audiences. And I can tell you that many physicians are not exactly clear what palliative care is either. A lot of times people think it's kind of like hospice, or it's before you get to hospice. But essentially the definition, and this is from our professional organization, is to provide relief from the symptoms and suffering and stress of serious illness. So if anyone listening knows a family member or knows someone in their circle who has significant heart failure or lung disease or advanced cancer, those serious illnesses bring with them suffering, emotional suffering, physical suffering, stress, lots of loss and symptoms. And palliative care, regardless of where you get it, sometimes hospitals have it in the hospital setting. Sometimes there are clinics with palliative care. Our program is where we send nurse practitioners into the home, and they work in conjunction with the patient's physician. So we don't come in and take over people's care, but we have a real specialty. Next slide, Terry, in helping people with serious illness feel better. And so here's just kind of an overview of what my team does. So I have 4 nurse practitioners on this team, and we geographically cover about 6 counties that there's the same footprint of as Hospice of Cincinnati, Hospice of Hamilton. And then I have 2 nurses in the office, a social worker, and then an office coordinator who does all the intake, and she's kind of like our air traffic controller. So there is a lot of need for this service. I call it sort of the Mary Poppins or the secret sauce of healthcare. And so it's worth understanding what palliative care is so people embrace it instead of say, oh, no, I'm not ready for that yet. And I say, if people say I'm not ready for that yet, then that usually is a clue to me to say, well, are you ready to have less suffering? And most people want to say yes. And then we go on to tell them what the program can do. So it does require a physician order, since our nurse practitioners work side by side with the physician. It can be a primary care physician, it can be an oncologist, a lung doctor, a heart doctor, anybody who's managing, any physician who's managing that serious illness. And we help provide, this team help provide stabilization. And it is in the home or independent living or assisted living. We're not yet in the nursing home environment because there's some additional things to consider to provide this kind of care in conjunction with a nursing home. But for the most part, this is in a person's home. And so the team essentially looks at what's been sending the person to the hospital: shortness of breath, anxiety, pain, sleep, inability to sleep, appetite suppression, feeling bad, all of those physical or emotional symptoms connected to having a serious illness. The nurse practitioners evaluate medications, they evaluate what happened in the last hospitalization. Sometimes people don't have a lot of psychosocial needs, and when I say psychosocial, that means, can you get your medicines? Do you have food? Can you get to the doctor's office? Do you need placement in a different, in some kind of facility? That's kind of, in general, psychosocial. But one of the things that they are particularly skillful at are goals of care discussions. And so if you think back to how I described advanced care planning, healthcare proxy, living will, goals of care discussions are kind of the next chapter of advanced care planning. This can include like an emergency health plan because somebody doesn't want to go back to the hospital. So let's talk about what you might do if you have those symptoms again. And it also means, if something happens, do you want your caregiver to call 911? Are you clear about what CPR might be like for you? So I can tell you that CPR on my 30-year-old versus on me versus on my 86-year-old mom is going to be a completely different experience, right? CPR was never intended to be used on folks with serious illness, frailty, folks in decline. We do it all the time, but it's really hard on the body, and people oftentimes don't come back to the state that they were in. So one of the things that nurse practitioners are really good at is talking to the patient and the family about goals of care conversations, which could include, do you want us to call 911 and do you want CPR? All of those conversations. Does hospice care fit into your vision of these next few months? So in addition to managing symptoms, the goals of care conversations really help clarify for families and patients what the next steps might be, and also can really add some relief when people are like, oh, nobody's ever really told me exactly about how serious my heart failure is or what some other options are. Anyway, I'm a big believer. It's a pretty big movement. Palliative care is a pretty big movement across the country. And locally, we have some hospital-based services. Hospice of Cincinnati, Hospice of Hamilton has inpatient palliative care at Tri-Health or at Good Samaritan Bethesda North. We're starting a program out at Mercy West. And then this home palliative care program, like I said, goes across many counties. It is not home health care. So some of you might be familiar with home health care, which is a terrific adjunct service. We send the nurse in to do a dressing change or to give an IV medication. We send physical therapy in to help people get stronger. This is nurse practitioner level care, kind of overseeing and kind of looking at the big picture and making recommendations and suggestions to the patient, family, and the physician. We work very well shoulder to shoulder with home health, but this is not home health as you might know it. And the nurse practitioners do bill insurance companies and Medicare for their services because they are independent providers. And so oftentimes patients or families will get a bill for a copayment just as if they were going to a doctor's office. Next slide, Terry, and then I'll pause here and see. I don't see Tiffany on my little screen. Any questions so far about palliative care? Be really curious to know if anybody listening in has had any experience for themselves or a family member with palliative care. It's a pretty terrific service. And so this is essentially just reframing what I just said, why it's a different service. It really is a niche service. The nurse practitioners are independent providers who work under the direction of a palliative care physician. The nurses in the office help connect all the dots. The social workers can actually help with advanced directives. for our palliative care patients, and then make other connections to services. And then really keeping the physician who stays in charge of the person's care, really help them manage symptoms, a lot of times making recommendations for different medications or different doses of medications. The other thing I'll say is what makes this practice unique is that we're sending a provider, so a nurse practitioner, into the home. And we know that people look different and seem different in the home than if they go to the doctor's office or if they go to the hospital, right? We're seeing that person as an individual, but not in the context of their home environment. So a lot of times, as you can imagine, folks' living environment makes a difference in how they're doing at home. So the oxygen tubing doesn't reach from the second floor to the first floor. There's no bathroom on the first floor. The water's turned off. The refrigerator's not working. So it's just another opportunity for our team to look at the whole picture. Why is this person suffering? And what might we do medically, socially, emotionally to help relieve some of that suffering? And then last, yeah.
Sorry, I do have a question. Could you, and you may, and this may come up down the road when we address hospice, but can you share that what type that you can seek aggressive treatment with palliative, or can you, in terms of what if someone was on receiving chemo treatments or dialysis?
Yep.
Are they able to team up with palliative care services? Well,
yeah, so that's a great differentiator, Terry. So Terry's question is, so that if someone has cancer and they're seeking chemotherapy, if someone has heart disease and they're seeking a procedure on their heart, they have kidney disease and they're seeking or getting dialysis. Those are all folks with serious illness with lots of symptoms, and that's where palliative care fits right in. So when I talk about hospice care, there's a few more limitations around being eligible for hospice care. So it's one of the reasons that I think that there's a fair amount of confusion with physicians as well as community folks around what palliative care is. You don't have to give up your physicians. You don't have to give up your treatment plan. And a lot of times if people are seeking aggressive or curative treatment, there's symptoms from those. So if you're getting pretty heavy duty chemotherapy, there's symptoms that come along with that. And that's where the palliative care team can help people feel better while they're seeking that treatment. But I'll also say, Terry, for those kinds of folks with advanced cancer who are getting, maybe a third round or a fourth round of chemotherapy or dialysis, the goals of care conversations can be really helpful because people don't always think about what's the next step here for me if the chemo doesn't work or the dialysis becomes so cumbersome that I don't want to do it anymore. So, but to your point, this is a supportive, an extra layer of support for folks with serious illness, whatever treatment plan they're on. Does that answer your question?
Thanks. Yes, it does. Thank you.
Yeah.
Barbara, I have a quick question. As I said before,
Yeah.
I work with hospice in palliative throughout Dayton-Cincinnati corridor. And something I've seen up in Dayton, and I'm just asking to see if TriHealth has, is a standalone palliative care clinic. It was part of Ohio Health, or Hospice of Ohio, Hospice of Dayton palliative care that's relatively new. And it used to be called Innovative Care Solutions, but I think they've changed it. But does TriHealth or Hospice of Cincinnati have any standalone facility like that?
So what you've described, I'm familiar, and I think it's Care something or other. I can't think of the name. That free, like a three-story freestanding building. It's inpatient palliative care as well as outpatient, like clinic-based palliative care. So we've got a little bit more of a mixed model. So the short answer is no, we don't have that kind of structure. So for inpatient palliative care that's not hospice, that is such a new concept that most of the insurance plans haven't signed up yet to figure out how to pay for that kind of care. But there are other ways you can get someone who has a palliative need into an inpatient setting. At TriHealth, not at Mercy yet, but at TriHealth, we have a couple of specific palliative clinics that are affiliated with either the Cancer Center or the Heart Center. So
like
it's kind of a, is
that Lisa Taphorn's group?
Right, Lisa Taphorn's group is now my group, actually.
Yeah.
They've recently migrated over to Hospice of Cincinnati Navigators. Yes, that's exactly Lisa Taphorn's group. So Catherine Pham does some work in the outpatient cancer clinic, and our group is getting ready to probably do similar with the heart failure clinic. So the reason, so it's a good question, because a lot of those specialties can really use embedded palliative care, heart and cancer in particular, but I would say respiratory as well. The COPD and chronic lung folks really have a lot of symptoms. But folks are so sick. One of the reasons we really decided to start with home palliative care, even though it's a fairly expensive model, as you can imagine, is because people are so low energy and so sick, so symptomatic, it's oftentimes hard for them to get out and to get into a clinic setting. So we offer it a little bit more separate than Ohio Hospice of Dayton's sort of one-stop building.
Thank you.
Yeah. Any other questions or comments on palliative care? Palliacare is the name of the program. Palliative care, meaning reducing symptoms and suffering of serious illness, is the concept. And like I said, it can be in the hospital setting, it can be in the doctor's office setting, and it can be in the home setting. And some palliative care services do go into long-term care for consultation. And we are actually working with Terry and her group to figure out the best way to do that. The medical director and the director of nursing, of course, have to be on board. And so we have a couple of pilot sites in the Cincinnati area where we're piloting some palliative care consultation and long-term care, particularly folks who go into sort of that acute rehab place in long-term care, who come out of the hospital after a hospitalization to get their strength back. They're really at risk for going back to the hospital for a variety of conditions. And so we want to figure out the best way to help support folks in that space. Okay, and then lastly, I'm going to talk just a little bit about hospice care. So hopefully you can kind of see the pathway, starting with advanced care planning into palliative care and now hospice care. It gives you a much bigger picture of all that we can do for folks with a serious illness, and not just hospice care, which is at that very end stage part of a person's life. So this is just kind of a general definition. Certainly patient-centered, family-focused approach to end-of-life care. It's a Medicare benefit, but the real difference, the real distinguishing factor here is that two physicians actually have to agree that if the disease or if the illness takes its usual course, we would expect the life expectancy to be 6 months or less. And currently, the Medicare hospice benefit was written 45 years ago. It does not allow for concurrent care, which is back to Terry's point. So if someone is still getting chemo, they want to try one more round of chemotherapy or one more fill in the blank, hospice is not an option. And so that was, I think, in part how palliative care came to be. And that the discipline of palliative care is only about 20 years old. It's a fairly new specialty. So Hospice of Hamilton is part of Hospice of Cincinnati. Go ahead to the next slide, Terry. And I won't spend a huge amount, and go ahead and click it again. It's got a couple of other boxes in it. Click, click. There we go. stop. For the most part, I think one of the things we'd like to make sure that we cover is that for the most part, hospice care is really home-based. That the whole team, so it's nurses, and my next slide kind of goes over the whole gamut of services: nurses, social workers, chaplains, medications related to the terminal illness, medical equipment like a bed or oxygen wheelchair, those kinds of supportive things. All of that is provided under the hospice benefit, mostly in what the person and where the person calls home, so their dwelling or the long-term care facility. And only 10% of all of the care that we provide at Hospice of Cincinnati and Hospice of Hamilton is actually in the facility, the inpatient care center that you may be familiar with up in your part of town. So that's when a patient is having a lot of symptoms that can't be managed at home. They'll come into the inpatient care center. And then also, because families, friends and families are really the primary caregivers in hospice care. And I think that's another misconception. People think when they sign up for hospice care that there's this sort of 24/7 model of hands-on care from a third provider, and that's just not the way the benefit is designed. But it's hard to take care of folks who are in their final months and weeks. And so a good thing about the hospice benefit is that there's this respite care. So the patient can come into our facility for 5 days while the family can just rest and get get their energy back. And then sometimes patients do die in our inpatient care center, but it's only a very small part of where we provide hospice care. Anything to add to that, Terry?
And the only other point I thought of is that when they come in for respite care, that's covered under Medicare. So providing those 5 days isn't going to cost the family or the patient anything at all. Mm-hmm. It's very, I think it provides, like you said, Barb, a lot of help and support for families, or maybe they have, maybe, they're going to take a small vacation and they're not sure what to do with their loved one who's in hospice. They have those 5 days to come in and we take care of them, and it really gives the family that break. Yeah,
because we are staffed 24/7 in the inpatient care center. In the home-based setting, it depends on the needs of the patient. But the nurses and the social worker and the nurses' aides come in periodically to help the family care for the patient. Next slide, Terry. This is just kind of a snapshot of all of the things that hospice offers. Care plan, expert management of symptoms, right? So you heard me talk about symptom management. In palliative care, we do exactly the same thing in hospice care, managing physical and emotional pain and suffering. It's just in a more limited space, right? To be eligible for hospice care, there's the 6 months or less life expectancy, and then some other criteria. And sometimes we hear from families, their family member is really sick and not doing very well. We'll send a hospice nurse out for evaluation, and they don't quote unquote meet criteria. That is not Hospice of Cincinnati or Hospice of Hamilton's criteria. That's the criteria from Medicare and CMS. So there are can be some fairly firm guidelines about who is eligible and who's not. And those are the cases. If they can't come into hospice care, then we'll make an automatic referral to palliative care, because we know that there's some need for sure, even if it's not yet hospice. And hospice has physicians, nurse practitioners, nurses, with the addition of chaplains and volunteers and holistic practitioners. So a very comprehensive team who's very focused on all of the work that comes at someone's end of life and all of those family dynamics that need supported. So it's really terrific. My father was in hospice care in South Carolina a couple of years ago. He was in significant decline for about 3 years. And my mother, who's a nurse, and I have my nursing background, and you know, I would say, be a good idea to get a hospice evaluation. And even my mother, who knows in her head that that's the right way to go, for a couple of times she said, oh, I don't think we're quite ready for that. Fortunately, he had 3.5 months of hospice care in the home before he died, and it was really a great experience. So one of the things that we really like for folks to know is the longer you're in hospice care, the better it is for the family, the loved ones, and the patient. We so often see people come into hospice care very, very, very late, and maybe just a few days before they die or a week before they die. We're happy to provide service to anyone in that space, but we can tell you firsthand that the longer you're in hospice care, the more value there is to the whole entire experience. So tuck that away. And that goes to that, no, we're not ready for hospice yet. And I think that oftentimes families are just really not ready to say goodbye to their loved one. However, if we can get them past that, I'm not ready for that, there's so much more value the longer that you get hospice care. So medications, equipment, grief services, go ahead and next slide, Terry, we're just about wrapping up here. And then, so part of the hospice benefit is providing then grief services to family members left behind. And so Goldstein's Family Grief Center is our grief program right now. Most of the grief counseling is being done via Zoom. And then we also do some in-person counseling when we're not in a pandemic, and some group support. So we often will make sure, I mean, it's part of the whole hospice package, but and then there's some outreach, some letters, and some just check-ins. Volunteers make calls to ask folks how they're doing after their loved one has died. So it's part of that whole package, starting with advanced care planning, into palliative care, serious illness, to hospice care at the very end of life, and then life after loss, after someone has died. So it's that whole sort of soup to nuts approach. And I think that's pretty much it content-wise. I know I've chattered around. I appreciate having questions. And then this would be the time to ask any other questions, or if we can provide any other support or information. Next slide, Terry, is just questions, and then it's got my email address too.
Any other questions for Barbara? Okay, thank you so much, Barbara and Terry. We really enjoyed that. Very good information. Like I said, we'll put this up on our YouTube channel, and since we weren't able to navigate to Facebook Live, we can share that the YouTube this week on our Facebook.
Sure.
For that, and then next week, sorry, I had it up. And next week, I believe we have Carol Lucio. I'm pulling it up real quick for Coffee and Conversation at 9 a.m. Carol Lucio with Butler County Safe Communities, and Matt Loeffler with Butler County Engineers Office, and they'll be sharing traffic safety citizenship information. So join us, and you can register at hamilton-ohio.com. All right. Have a great day, everyone. Thank you so much.
Thanks
for the invitation. Appreciate it. Bye-bye.
You're welcome.